Dr. Baker mentioned before, kind of we've got the biology, we've got the psychology, and the social. And Corey, if you can just like click through all of those. Yeah. So we got the psychology piece, right? That's me sitting. Parents and kids are really used to waiting for that angle, right? They're waiting for someone to tell them this is just in their head, or it must be because of some additional stress or anxiety or trauma that you're just not telling us, or maybe it's because you're being bullied at school and you just haven't really talked with anyone about that yet. There's actually nothing more infuriating to a family than insisting that there must be some hidden trauma or some hidden stressor that they're not telling you. It's important to assess, and it's important to normalize that we understand that children's and families' lives, particularly now, are remarkably stressful and overwhelming. So we're asking about these things for a reason, but it doesn't mean we're saying that they're the singular cause of it, but we can't ignore it. And then from the biology piece, we bring up the medicine aspects, and often kind of borrowing from your physician and nursing colleagues to use the information that you've already gathered from them from their initial workup to say, oh yeah, I hear that you have a family history of IBS, or I've understood that some things in your body are a little bit more sensitive. You're noticing that you get frequent headaches. There was that time that you got this inflammation or this allergy response. Understanding different hormone expressions associated with developmental processes of puberty. It's important to throw these out on the table because you're saying that you are considering all of these factors as well. And then of course, lastly, the social piece, which is going to be the bulk of what we chat about here as it pertains to the interaction with school. We need to talk about school. We need to talk about families. Again, not just as potentially exacerbating and triggering factors to this cycle, but also as areas for intervention and treatment. We view families, school, peer, relationships with your medical team as therapeutic opportunities for improving DGBI functioning. So it's not just that we're assessing these things to try to, again, find that hidden thing to complete our conceptualization. It's actually looking for opportunities for partnership and for treatment opportunities to be able to improve functioning overall.